Good evening. Thank you for joining us tonight. I'm Rolly Hoyt.
And I'm Marlisa Goldsmith. We begin tonight with a life-saving medicine, insulin.
Yeah, the cost is top of mind for those who need it, but now there could be hope after President Joe Biden announced he'd like to cap the cost.
THV11's Ian Russell sat down with those working with insulin daily who say a change in price is long overdue.
Madam Speaker, the President of the United States.
A busy night in Washington is leading to conversations in the natural state, not about politics, but medicine.
Let's cap the cost of insulin at $35 a month, so everyone can afford it.
It's an idea that President Biden has pushed for a while. For those working directly with people who need insulin, they say it's a move that's long overdue.
And the patients certainly can go broke almost trying to pay for something that is necessary and going to save their life.
Ann Pace is the pharmacist in charge at Kavanaugh Pharmacy in Little Rock. She knows how expensive insulin can get. She sells it.
That's what we're here for, is to help keep people healthy. And when the cost is an issue, it's extremely frustrating.
For example, these are 4 insulins that Pace sells. A box like this couldn't be more than $15-20, right? Unfortunately not. These are hundreds of dollars a piece.
How that can be very problematic for people, everyone, whether you have, are well off or not, that it's a problem.
Pace isn't the only one who knows this. Dr. Joseph Henske runs UAMS's diabetes program and knows the struggles the price can bring.
If it's not affordable, it doesn't matter what the best medication is because you can't give it to them. You have to give to them something that they can afford.
And he doesn't just know what his patients are going through when it comes to the price. He also gets it.
Even for me personally, I've had diabetes since I was a kid.
Now, it's hard to say if or when this cap could actually happen. While President Biden is pushing for the change, it still has to be brought up in Congress. After that, it's unclear. Even with the uncertainty, it's optimism that Dr. Henske is feeling, and hope this happens soon.
I think with a lot of discoveries in medicine, I think the physicians and people involved can see the future and it will happen, but no one can predict how quickly.
In Little Rock, Ian Russell, THV11 News.
Thanks so much, Ian. Dr. Henske says if this were to happen, it could immediately benefit his patients.
Yeah, he says he's had patients tell him they've rationed their insulin instead of taking the required dose because of how expensive the vials are.